Now, my dear friends, let us talk about the third part of pharynx, oropharynx. And the most important structure in oropharynx is tonsil, which is also called palatine tonsil. It's again a lymph tissue. The tonsil is very well-defined lymph tissue. Tonsil has capsule, tonsil has crypts, and tonsil has definite blood supply. If you remember, adenoid has no capsule, no crypts, and no definite blood supply. What is a crypt? Can you see these invaginations of the epithelium in the substance of the tonsil? These depressions are called crypt. And one crypt goes very deep, and that's called crypta magna. If the cryptinaceous debris gets stuck in one of these crypt, it is called tonsillolith. Look at this picture of tonsillolith. Now let's talk about what is the main blood supply of tonsil. The answer is tonsillar branch of facial artery. What is the main venous drainage of tonsil? Paratonsillar vein. And this vein is the main source of bleeding during tonsillectomy. Now let us talk about some more, question about the anatomy of the tonsillar region. My dear friends, the bed of the tonsil is made by superior constrictor muscle. This area below the angle of mandible. Two anatomical structures lie in the bed of tonsil. What are they? Number one, styloid process, and number two, glossopharyngeal nerve. By chance, there is elongated styloid process, very long styloid process, and it starts pressing the glossopharyngeal nerve. It leads to throat pain, referred to ear, and that is called eagle syndrome or styalgia. How to remember in an easy way? Look at this eagle holding the snake. The claw of the eagle reminds me of the long styloid process, and the snake reminds me of glossopharyngeal nerve. Which artery lies 1 inch deep to the bed of the tonsil? The answer is internal carotid artery. Therefore, the pulsating tonsil can be one of the presenting feature of internal carotid artery aneurysm. Let us talk about tonsillectomy now. What is the most common method of tonsillectomy? Dissection and snare method. It's a pretty bloody surgery, tonsillectomy. There are three different types of hemorrhage in tonsillectomy and a very important question. The first type is primary hemorrhage. Look at the surgery being done. A lot of blood loss occurs during surgery, and this bleeding, this hemorrhage is primary hemorrhage, and it is coming from tributaries of paratonsillar vein. The surgeon controls the bleeding by tying the blood vessel with a suture. The patient is brought to the ward and kept under observation for 24 hours. If no bleeding, no problem, we discharge the patient after 24 hours. But by chance, patients start bleeding in the ward within 24 hours of the surgery. It is called reactionary hemorrhage. So number two is reactionary hemorrhage. It's a post-operative bleeding within 24 hours of the surgery in the ward. What is the cause of this? Slippage of ligature. That stitch you applied to tie the vessel was loose, it came out. And it's a very serious emergency in ENT. Why? It's a severe bleeding. Patient is vomiting blood. You are the intern in the ward. Mother, sisters will come to you for help. Now you have to keep in mind, this patient can die because of number one, hemorrhagic shock, and number two, aspiration of blood. You will inform me on the phone, Dr. Dhawan, come fast. In the meantime, what would you do? You will start intravenous fluids. Number two, you will arrange the blood transfusion. Number three, you shift the patient to operation theatre and arrange the anesthetist and the nursing staff also. What is my role? When I come over there, the treatment of choice of reactionary hemorrhage is urgent re-exploration in the operation theatre under general anesthesia. Re-exploration means reapply the stitch. How to make easy way? RE reactionary, it needs RE re-exploration. The third one is a late hemorrhage, delayed hemorrhage. It's called secondary hemorrhage. It occurs in home. Patient got discharged. After 24 hours, he was absolutely fine. Now, reactionary hemorrhage is in the ward, but secondary hemorrhage is in the home after a couple of days after discharge. What is the cause of secondary hemorrhage? Infection of tonsillar fossa. What went wrong? We always instruct the parents not to give anything solid to the child for a couple of days after surgery. But unfortunately, mother gave some rice or chips to the child after surgery. Now, these rice particles got stuck in the tonsillar fossa, which is raw right now, and that lead to infection of tonsillar fossa. And this is a mild bleeding only. I'll get a call on the phone from mother, Dr. Dhawan, when the child spits, there is fresh red color in that. I'll call them back to the emergency or the OPD, and I will admit the patient again in the hospital, and treatment of choice of secondary hemorrhages, intravenous antibiotics, plus semi-solid diet for a couple of days. So this is primary hemorrhage in the operation theatre, reactionary hemorrhage in the ward within 24 hours, and secondary hemorrhage is delayed late hemorrhage in home. Don't forget to revise this one. Let us go further. Very commonly we see whitish membrane on the tonsil. The most common cause of whitish membrane on tonsil is acute membranous tonsillitis caused by Streptococcus pyogenes. Number 2, infectious mononucleosis caused by Epstein-Barr virus. Number 3, diphtheria. Never forget that. Now, diphtheria membrane, look at this picture of diphtheria membrane. It extends beyond the tonsil to the soft palate area or down towards the laryngeal area also. Number 2, it's a pseudo membrane. You can scrape it out. And when you scrape it out, there's a bleeding on removal. So 3 points about diphtheria membrane is, number 1, it extends beyond tonsil. Number 2, it's a pseudo membrane. And number 3, it bleeds on removal. The other cause of grayish white membrane on the tonsil is Vincent angina. It is caused by Borrelia vincenti plus fusiform bacillus. And this whitish membrane can also be due to candidiasis, leukemia, and agranulocytosis. My dear friends, let us know an anatomical term called Waldeyer ring. By now you know, we have a lot of lymphoid tissue in the pharynx. Like adenoid is lymphoid tissue, tonsil is lymphoid tissue. There's something lymphoid tissue on the tongue also, called lingual tonsil. So there's a lot of lymphoid tissue make a ring of immunity in your pharynx, and that ring is called a Waldeyer ring. So it is internal mucosal ring of lymphoid tissue in your pharynx. Important question to remember for anatomy is the outer neck nodes, like posterior triangle neck nodes, supraclavicular nodes, or jugulodigastric nodes. They are not part of this ring. It's internal mucosal rings. Outer neck nodes are not part of this ring. Okay, so let us do one more interesting question about tonsil, the biochemistry ENT overlap. Orange tonsils are seen in which biochemistry disorder? Tangiers disease. And Tangier disease is lipid metabolism disorder. And that reminds me one more biochemistry ENT overlap. Laryngismus stridulus, spasm of larynx, is a feature of vitamin D deficiency, and it's seen in rickets.